Inside the box is the meter, the lancing device, lancets, and the test strips. Remove the cap, insert a lancet, twist off the needle cover, and then replace the cap. Use the dial to set the depth of the needle to 2 or somewhere in the middle of your lancing device's setting. If you're not getting blood consistently from the lancing device, dial up to the next number. Insert the test strip into the meter. With the freestyle test strips, the butterfly side goes up. Inserting the test strip wakes the meter up. The meter will then tell you that it wants a drop of blood as indicated with the flashing drop icon. Wash your hands with soap and water or use an alcohol wipe. Allow your finger to dry. The best place to test is on the outside edge of your finger. It hurts less. Push the button on the lancing device, which releases the needle. Squeeze to allow a drop of blood for sampling. Put the test strip up against the blood drop. The meter should then show you your blood glucose number. Remove the used lancet. Place it in a hard plastic container to store your used needles, not the trash.
Is the right time to check your blood sugar? Many patients have had diabetes for years and are still not exactly sure when they should perform their fingerstick tests. We will cover 5 general rules about the correct timing of fingerstick blood sugar checks. These apply to most people with diabetes. Rule 1. Know the basics. The most valuable times to monitor your blood sugar are no more than 15 minutes before a meal and 2 hours after a meal. The first blood sugar reading taken before breakfast is called fasting. Blood sugar readings taken 2 hours after a meal are called postprandial. If a patient checks their sugar 15 minutes before and 2 hours after every meal, that would add up to 6 finger sticks per day. This recommendation can become overwhelming, so it is often simplified. Rule 2. Less might be more. Check your blood sugar before meals and at bedtime. Checking your blood sugar before meals and at bedtime works well because it is easier to remember and get into the habit of checking at these times. Having some information is better than none. Additionally, monitoring before meals and at bedtime gives your doctor enough information to make decisions on the treatment of your diabetes. With 4 fingerstick values in a day, the doctor can get about the same information as what they would get with 6. Rule 3. The number of fingerstick checks per day is different for every patient. While the right time to check the blood sugar is similar for most patients, the number of times a patient should monitor their sugar is specific to the individual. If the diabetes is very well controlled and the patient is not on medications that can cause abnormally low blood sugar, hypoglycemia, the doctor may recommend not checking the blood sugar at all. If a patient is on insulin injections, checking the blood sugar as often as 3 to 6 times per day is recommended, depending upon the number of injections. Check with your doctor about how often they expect you to monitor your specific situation. Rule 4. Don't discriminate. Alternate. Changing the time of day when you check your blood sugar is almost as important as the time you check it. Think of monitoring your blood sugar like playing a game of hopscotch. In hopscotch, you land in a different box every time you jump forward. You would never win if you kept jumping in the same box over and over again. This is the same idea as checking your finger stick every morning over and over again at the same time. You would not gain enough new information to help you manage your diabetes better. In addition to the morning level, you should check values from before lunch, before dinner, and at bedtime. Most patients with diabetes have high blood sugars after eating. By only checking the blood sugar in the morning after fasting, patients will miss discovering this problem. Rule 5. Don't be a clown, write it down. After going through the trouble of checking your sugar, you should also keep a log of the values to review with your doctor. A doctor can scan over a written log and look for patterns much more easily than through a glucometer. The best types of patient glucose logs are ones that show the blood sugar checks throughout the day written horizontally on the page, starting in the morning and ending at night. A list from top to bottom can be a little confusing for doctors to interpret because it is more difficult to look for trends at particular times of the day.
Carbohydrates are one of the 3 macronutrients essential for providing energy to the body. They are found in a variety of foods, including grains, fruits, vegetables, legumes, and dairy products. When consumed, carbohydrates are broken down into glucose, which is then absorbed into the bloodstream and used as fuel for the body's cells. However, not all carbohydrates are created equal when it comes to their impact on blood sugar levels. Complex carbs. What are they and how do they affect blood sugar? Complex carbs are carbohydrates that contain longer chains of sugar molecules. They are often found in whole grains, such as brown rice, quinoa, and whole wheat bread, as well as legumes, such as lentils and chickpeas, and certain vegetables like sweet potatoes and broccoli. Due to their longer chains, complex carbs take longer for the body to break down and absorb, resulting in a slower and more gradual rise in blood sugar levels. When you consume complex carbs, your body needs more time to digest and convert them into glucose. This slow and steady release of glucose into the bloodstream helps to prevent sudden spikes in blood sugar. It also provides a steady source of energy, keeping you feeling fuller for longer and preventing cravings and overeating. Simple carbs. What are they and how do they affect blood sugar? Unlike complex carbs, simple carbs consist of shorter chains of sugar molecules. They are commonly found in foods and beverages that are high in added sugars, such as candy, soda, pastries, and sugary cereals. When you consume simple carbs, the body quickly breaks them down into glucose, leading to a rapid increase in blood sugar levels. The rapid rise in blood sugar caused by simple carbs can be problematic, especially for individuals with diabetes or those looking to manage their blood sugar levels. When blood sugar levels spike, the body releases insulin to help transport glucose into the cells. However, excessive and frequent spikes in blood sugar can lead to insulin resistance over time, which is a precursor to type 2 diabetes. Glycemic index and glycemic load, measuring the impact of carbs on blood sugar. To better understand how different carbohydrates affect blood sugar levels, the concepts of glycemic index, GI, and glycemic load, GL, are used. The glycemic index is a ranking system that measures how quickly a carbohydrate-containing food raises blood sugar levels compared to pure glucose, which has a GI of 100. Foods with a high GI are rapidly digested and absorbed, causing a sharp increase in blood sugar levels. On the other hand, the glycemic load takes into account both the quality and quantity of carbohydrates in a food. It considers the GI of a food as well as the portion size, providing a more accurate measure of the impact on blood sugar levels. Foods with a low glycemic load have a slower and more gradual effect on blood sugar, making them preferable for blood sugar control. Understanding the glycemic index and glycemic load can help individuals make informed choices about the types and amounts of carbohydrates they consume. By opting for foods with a lower GI and GL, you can better manage your blood sugar levels and maintain a more stable energy throughout the day. The importance of balanced meals for blood sugar control. When it comes to managing blood sugar levels, it's not just about the type of carbohydrates you consume but also how you combine them with other nutrients. Balanced meals that include a combination of complex carbs, protein, and healthy fats can help regulate blood sugar levels more effectively. Including protein and healthy fats in your meals helps slow down the digestion and absorption of carbohydrates, resulting in a slower and more gradual release of glucose into the bloodstream. This can help prevent blood sugar spikes and crashes, keeping your energy levels stable throughout the day. For example, instead of having a bowl of sugary cereal for breakfast, try opting for a bowl of oatmeal topped with nuts and seeds. The addition of protein and healthy fats from the nuts and seeds helps balance out the carbohydrates in the oatmeal, preventing a rapid rise in blood sugar. Similarly, pairing a serving of whole grain pasta with lean protein and vegetables can help slow down the absorption of carbohydrates and provide a more balanced meal. The role of fiber in carbohydrate metabolism and blood sugar regulation. Fiber is a type of carbohydrate that is indigestible by the body. It passes through the digestive system largely intact, providing a range of health benefits, including improved blood sugar control. There are two types of fiber: soluble and insoluble. Soluble fiber dissolves in water and forms a gel-like substance in the digestive tract. It helps slow down the absorption of glucose into the bloodstream, preventing rapid blood sugar spikes. Foods high in soluble fiber include oats, barley, legumes, and fruits like apples and oranges. Insoluble fiber, on the other hand, adds bulk to the stool and helps promote regular bowel movements. While it doesn't directly impact blood sugar levels, it plays a crucial role in overall digestive health. Foods high in insoluble fiber include whole wheat products, bran, and vegetables like broccoli and carrots. By incorporating high fiber foods into your diet, you can help regulate blood sugar levels and improve overall health. Aim for a balanced mix of soluble and insoluble fiber to reap the maximum benefits. Tips for incorporating complex carbs into your diet for better blood sugar control. Now that we understand the importance of complex carbs in blood sugar control, let's look at some practical tips for incorporating them into your diet. Choose whole grains. Opt for whole grain bread, pasta, and rice instead of refined versions. Whole grains retain the bran and germ, which are rich in fiber and nutrients. Include legumes. Legumes such as lentils, chickpeas, and black beans are excellent sources of complex carbs and fiber. Add them to soups, salads, or stews for a nutrient-packed meal. Load up on vegetables. Non-starchy vegetables like broccoli, spinach, and cauliflower are low in carbs but high in fiber and essential nutrients. They can be enjoyed as a side dish or incorporated into main meals. Snack on fruits. Choose whole fruits over fruit juices or sweetened snacks. Fruits contain natural sugars along with fiber, which helps regulate blood sugar levels. Read labels. When shopping for packaged foods, check the ingredients list for added sugars. Opt for products with minimal or no added sugars. Be mindful of portion sizes. While complex carbs are beneficial for blood sugar control, it's essential to practice portion control. Overeating even healthy carbs can still lead to spikes in blood sugar levels. Incorporating these tips into your daily routine can help you make healthier choices and maintain more stable blood sugar levels throughout the day. The dangers of excessive simple carb consumption on blood sugar levels. While complex carbs are generally considered the better option for blood sugar control, it's important to be aware of the dangers of excessive simple carb consumption. Simple carbs, especially those found in sugary foods and beverages, can have a detrimental effect on blood sugar levels and overall health. Regularly consuming large amounts of simple carbs can lead to weight gain, insulin resistance, and an increased risk of developing type 2 diabetes. These foods provide little to no nutritional value and tend to be high in calories, which can contribute to obesity and other health issues. Additionally, simple carbs can cause a rapid rise in blood sugar levels, followed by a sharp crash. This roller coaster effect can leave you feeling tired, irritable, and hungry, leading to overeating and further blood sugar imbalances. To avoid the negative effects of excessive simple carb consumption, it's important to limit your intake of sugary foods and beverages. Instead, focus on incorporating complex carbs, protein, and healthy fats into your diet for better blood sugar control and overall health. Meal planning and portion control for managing blood sugar with carbs. Meal planning and portion control are essential strategies for managing blood sugar levels when it comes to carbohydrate consumption. Here are some tips to help you stay on track. Plan your meals. Take some time each week to plan out your meals and snacks. Include a balance of complex carbs, protein, and healthy fats in each meal. Use smaller plates. Opt for smaller plates and bowls to help control portion sizes. This can prevent overeating and help regulate blood sugar levels. Practice mindful eating. Pay attention to your hunger and fullness cues while eating. Eat slowly and savor each bite to prevent overconsumption. Pre-portion snacks. If you tend to snack mindlessly, pre-portion your snacks into individual servings. consult a registered dietitian. If you're struggling with managing your blood sugar levels or need personalized advice, consider consulting a registered dietitian. They can help create a meal plan tailored to your specific needs and goals. By incorporating these strategies into your daily routine, you can better manage your blood sugar levels and maintain a healthier relationship with carbohydrates. Conclusion: finding the right balance between complex and simple carbs for optimal blood sugar control. In conclusion, understanding the difference between complex carbs and simple carbs is crucial for effective blood sugar control. Complex carbs, such as whole grains, legumes, and vegetables, provide a slow and steady release of glucose into the bloodstream, helping to prevent spikes in blood sugar levels. On the other hand, simple carbs, often found in sugary foods and beverages, can cause rapid blood sugar spikes and contribute to insulin resistance. By incorporating complex carbs into your diet, along with protein, healthy fats, and fiber, you can maintain more stable blood sugar levels and avoid the negative health effects associated with excessive simple carb consumption. Remember to practice portion control, mindful eating, and consult a professional if needed to ensure optimal blood sugar control and overall health. So, next time you reach for a carbohydrate-rich food, think about its impact on your blood sugar levels and choose wisely. Your body will thank you for making healthier choices and maintaining stable blood sugar control for a happier, more balanced lifestyle. Thanks for watching.
You will begin taking insulin by injecting it with a needle into the subcutaneous tissue.
To determine when you should inject insulin, pay attention to the times you check your blood sugar, when you eat, and what kind of insulin you are taking. Check your blood sugar no more than 30 minutes before you eat. If you are taking rapid-acting insulin before meals, give yourself the insulin when you sit down to eat. If you are taking regular insulin before meals, give yourself the insulin no more than 30 minutes before the meal. If you are taking intermediate-acting or long-acting insulin, give yourself the insulin at the same time each day. There is no standard or typical dose of insulin. Your dose will be the amount of insulin that you need in order to keep your blood sugar in good control. Your doctor will prescribe an insulin dose that is right for you. The most common side effect of insulin is low blood sugar or hypoglycemia. Low blood sugar happens when the level of sugar in the blood falls below 70 milligrams per deciliter. Symptoms include sleepiness, shaking, sweating, dizziness, and hunger. Be sure you know how to treat low blood sugar before you start using insulin. An insulin injection delivers medicine into the subcutaneous tissue, which is the tissue between your skin and muscle. Subcutaneous tissue, which is also called sub-Q tissue, is found all over your body. Your healthcare provider has chosen insulin injections that are done with a syringe that is filled from a bottle of insulin as the best option for you. Here are the steps you will take. Select a clean, dry work area. The supplies you will need include the prescribed bottle of insulin, an insulin syringe, alcohol wipes, and a container for used equipment. You can use a hard plastic container with a screw-on or tight lid, or a commercial sharps container. Begin by washing your hands. If the bottle of insulin appears cloudy, roll the bottle in your hands and turn it from side to side for 1 full minute. You do not have to roll the bottle if the insulin is completely clear. Do not shake the bottle. If opening a new bottle of insulin, remove the plastic cap and wipe the top of the bottle with an alcohol wipe. If using a bottle of insulin that has already been opened, you will still need to wipe the top or rubber stopper with an alcohol wipe. Remove the caps from both the top and bottom of the insulin syringe. You may need to twist the cap to get it to come off more easily. Do not touch the needle. Pull back on the plunger to the unit mark for the insulin dose that has been ordered for you. Put the bottle on the table. Insert the needle straight into the top of the bottle through the rubber stopper. Push the plunger down to inject the air into the bottle. Turn the bottle upside down with the needle still in it. Hold the bottle at eye level. Make sure the tip of the needle is in the insulin. Make sure not to bend the needle when picking up the bottle. Pull the plunger back to the unit mark for the insulin dose ordered for you. If you see bubbles in the syringe, gently tap on the syringe so the bubbles move to the top. Push the syringe to release the bubbles back into the bottle of insulin. Once again, with the needle in the insulin, pull the plunger back to the unit mark for insulin dose that has been ordered for you. Check that the dose is correct. Set the syringe down without letting the needle touch anything. Since you will be injecting your insulin on a regular basis, you need to know where on your body to inject it. You will also need to learn how to rotate or switch your injection sites. Recommended injection sites include the abdomen, front and side of the thighs, upper and outer arms, and buttocks. Do not inject near joints, the groin area, the navel, the middle of the abdomen, or scar tissue. If you use the same injection site over and over again, you may get hardened areas under your skin that keep the insulin from working properly. Rotating your injection sites will make your injections easier, safer, and more comfortable. Follow these guidelines. Ask your healthcare provider which sites you should use. The injection site is about 2 inches of skin. Clean this area in a circular motion with an alcohol wipe. Move the site of each injection. Inject at least 1.5 inches away from the last spot where you injected. Try to inject in the same general area of your body at the same time each day. Keep a record of which injection sites you have used. Every time you give yourself an injection, write down the date, time, and site. Please note, depending on which type of insulin you are taking, absorption may be different for different parts of the body. Talk to your healthcare provider to learn more about the insulin you are using and which sites work best. Using the hand you write with, hold the syringe like a pen or a pencil, with the needle end down. With your other hand, pinch about 2 to 3 inches on both sides of the cleaned skin. Insert the needle with a quick motion into the pinched skin at a 90-degree angle. The needle should go all the way into your skin. Slowly push the plunger of the syringe until all of the insulin is pushed out. Stop pinching your skin and pull the needle out. You may bleed at the spot of the injection. If you notice bleeding, apply pressure with a clean alcohol wipe or a cotton ball. Cover the injection site with a bandage if necessary. Drop the entire syringe and needle into your container for used sharps equipment. Do not put the cap back on the needle. It's important to remember that when storing your insulin that you store unopened bottles in the refrigerator. Unopened insulin that is stored in the refrigerator will be good until the expiration date printed on the box. Write the date on the bottle when you first open it. Store the bottle you are using at room temperature. Avoid temperatures that are too hot or too cold. This can change how the insulin works. Most insulin is good for 28 days once it's opened. Check with your pharmacist or read the drug insert for exact instructions. Always check your medicine type and the expiration date printed on the box before you leave the pharmacy. Do not use insulin if it has lumps, is discolored, or has been frozen. Place used insulin syringes and lancets for blood sugar testing in a hard plastic or metal container with a screw-on or tight lid or a commercial sharps container. If you have questions about the subcutaneous injection procedure, please ask your healthcare providers. Thank you again for choosing Cleveland Clinic for your care.
What happens to your blood sugar when you work out, and how does exercise affect your blood sugar? Your body needs energy. The energy comes from the food you eat and is converted and stored in various ways, including in the form of sugar stores in your muscles and liver. When you work out, your muscles use up energy from these stores. Your blood sugar drops because the sugar in your bloodstream is being used by your muscles. The thigh muscles are the biggest muscles in the body and are activated by almost any movement, so they have a big influence on your blood sugar. If you push yourself very hard, you may find that your blood sugar rises during a workout. This is because stress hormones like adrenaline cause the liver to release sugar into the body. After a workout, you may experience lower blood sugar for up to 24 hours. Because your muscles have become more sensitive to insulin and have to restock their sugar stores. Physical activity is good for the whole of your body. Regular exercise gives you more physical and mental energy and prevents cardiovascular disease, high blood pressure and obesity. Exercise is more than just a workout program. Life is full of opportunities for being physically active. You can tell you're active at the right level when you get short of breath and start to perspire. Ready, steady, go!
Every doctor has regrettable moments about some patients whom they weren't able to save. For similar reasons, diabetic ketoacidosis, or DKA, is a medical emergency that I never take lightly. In today's episode of Interesting Medical Cases, I bring you the story of a 17-year-old girl with diabetic ketoacidosis. This is how we were able to save her after an intense battle against the disease. She presented to us with impaired consciousness. She had had excessive thirst, frequent urination, and vomiting over the past few days. We had a few differential diagnoses at first, but only one was left when the mother told us about her daughter's type 1 diabetic condition. This was a classical presentation of diabetic ketoacidosis. Her breathing was rapid and shallow. This was compatible with the Kussmaul breathing pattern seen in severe acidosis. Severe dehydration was able to explain the marginal blood pressure of 90/60. Following catheterization, she produced only 10 milliliters of urine in the first hour. This made us worried because low urine output indicates a poor prognosis. To establish the diagnosis, we needed to test her for elevated blood sugar, ketone bodies, and acidosis. In the absence of insulin, the liver breaks down the glycogen into glucose. We detected hyperglycemia with a simple glucometer. Her capillary blood glucose level was 400 milligrams per deciliter, a value compatible for diabetic ketoacidosis. As glucose is filtered into urine, water and electrolytes are dragged with it. This leads to the infamous dehydration associated with the disease. Urine output declines in severe dehydration. Detecting ketone bodies. We had a portable ketone meter which allowed us to measure the serum ketone body levels with a simple finger prick. The reading showed a dangerous level of ketone bodies of 3.2 millimoles per deciliter. Just to be sure, we also sent her urine to test for ketone bodies, though it's time-taking and found to be less sensitive. Glucose is the body's #1 fuel. Since glucose utilization is impaired in diabetes, the body breaks down fat and produces the alternative fuel ketone bodies. The fruity smell and exhaled air of DKA patients is caused by these ketone bodies. Detecting acidosis. The normal pH value of the blood ranges from 7.35 to 7.45. Any value below this range indicates acidosis in the blood. The massive buildup of ketone bodies in DKA makes the blood highly acidic. We can measure the pH value of blood using a blood gas analysis. I located her radial artery and drew blood into an ABG syringe and performed a blood gas analysis. The pH value of this girl came as 7.21. The anion gap had increased due to excess ketone bodies. The blood gas analysis was compatible with moderate diabetic ketoacidosis. In an attempt to compensate for the acidosis created by ketone bodies, the lungs start to hyperventilate to remove carbon dioxide. This is clinically observed as Kussmaul breathing. Now it's time to save her. So how do we treat DKA? Initial therapy. Due to the marginal blood pressure and reduced urine output, we started fluid therapy with a bolus of IV normal saline, followed up by an infusion at a rate of 20 milliliters per kilogram body weight per hour. After 3 hours, we gradually decreased the fluid rate. An insulin pump was used to deliver regular insulin at a rate of 0.1 units per kilogram body weight. Insulin therapy can cause hypokalemia. KCl was carefully added to normal saline by frequently monitoring serum potassium levels. Easing off. Removing too much glucose too fast can cause cerebral edema. Can you guess why? I'll provide the answer in the description. When the plasma glucose approached 200 milligrams per deciliter, we reduced the rate of insulin infusion and also changed the normal saline to 5% dextrose. These steps are essential to prevent cerebral edema. Then she was transferred to an ICU where the therapy was continued until her acidosis, ketosis, and glucose levels were corrected. Later, it was found that her DKA was triggered by a urinary tract infection. It was successfully treated with IV ciprofloxacin.